Hello, my name's Tim Heimgartner. This is a research presentation for class RAIM 301. This presentation is going to discuss the image fusion approach of using contrast-enhanced ultrasound with contrast-enhanced computed tomography to treat hepatocellular carcinoma with radiofrequency ablation. Now, as I reported in my previous research project from earlier this quarter, image fusion therapy is an emerging technique in radiology. It's due to its ability to combine multiple modalities into one simultaneous seamless integration of images that allow for greater accuracy and better clinical outcomes. Hepatocellular carcinoma. So it is the primary type of liver cancer, which means that it's a tumor that grows from within your liver, not from outside your liver. Most common causes here in the US of HCC are going to be hepatitis B and hepatitis C, as well as patients that have a long-standing history of alcohol abuse. HCC tumors are challenging and complex to treat, primarily because of their location within the liver, and these patients that often present in various different stages of HCC progression, and they often have a widely different type of tumor biology. That makes them often, difficult and challenging to treat. They're also the sixth most common cause of cancer and the third leading cause of cancer death here in the US. Ultrasound is the preferred frontline imaging modality for diagnosing HCC because it's quick, it's convenient, and it's inexpensive. Ultrasound is a non-invasive therapy that uses piezocrystal transducers that produces sound wave. The sound wave emits a frequency which reflects back in the form of an echo, creating these images that are then placed onto a computer screen or a monitor. Intraoperative ultrasound is the primary method for guidance during surgery of hepatocellular carcinoma tumors, because it allows for continuous localization of the tumor, visualization of the margins, and it allows to see where the healthy tissue is at. Now, ultrasound does have some limitations with patient anatomy because it has a relatively low spatial resolution and penetration. It also has a coarse background with the patient that has liver cirrhosis, and it also has some interference with bowel gas if the patient's really gassy, which is where contrast-enhanced computed tomography comes in. This is the other preferred imaging modality for visualizing and treating hepatocellular carcinoma. CT is a rotational X-ray that images in cross-sectional slices of the body. It's a fast imaging X-ray form that usually cuts these slices through the patient in 1 to 10 millimeters, creates a 2D image. However, after the scan is done, there is software that allows the technologist to go in and stack those images, creating a reconstructed 3D version of the image during the post-processing fashion of CT. CT has a higher spatial resolution than ultrasound. It also has a bigger field of view, so it has better visualization of the overall patient anatomy and adjacent organs that ultrasound doesn't. It also, with the enhanced use of contrast in the patient, it does allow for better visualization of the blood vessels in the liver, and it shows them more prevalent than, say, with ultrasound. The only downside is that CT does cause radiation, and it is somewhat costly. So, interoperable fusion imaging for radiofrequency ablation of hepatocellular carcinoma. This is a new trend that we're seeing, combining these two modalities in one. So it blends ultrasound and CT, and what this does is it increases the probability of locating the tumor accurately and treating that tumor with the highest clinical precision. It also visualizes where healthy tissue is and where adjacent organs or tissue lie, so we don't make sure that we're not ablating healthy tissue. So what it does is it displays ultrasound and CT simultaneously on the screen. So what that also does is the setup is kind of as such. A magnetic navigation system is placed over the patient's anatomy. And then from there, the tech will scan the patient's anatomy according to the CT. After 2 images match well, or they've mapped out the patient's anatomy, the operator increases the visualization of the tumor, which allows for greater accuracy and precision. The ultrasound allows for guided tracking too. So when the physician or surgeon wants to go in and ablate these tumors within the liver, the ultrasound gives them a real-time image of where they're at, located within the patient's anatomy. Now, what is RF, or radio frequency? So it's also known as microwave ablation. It's just a percutaneous big needle that's inserted into the liver, and it emits a radio frequency, which essentially destroys the tumor. And usually these tumors are encapsulated. There's a picture of one up here in the right-hand corner. And what it does is it goes in there and it cooks the tumor and does not touch, hopefully does not cook adjacent healthy tissue. This is also a picture of an ultrasound, cartoonish picture looking at the RF ablation of the tumor up here in the right-hand corner. The benefits of using this type of technology is that it's going to increase the confidence of the proceduralist, because he or she is going to have 2 images to rely on. They're going to have the accuracy of the CT image that's overlaid with the ultrasound, and the ultrasound is going to give them that real-time guidance that they're actually in the capsule of the tumor and not treating unhealthy tissue or treating healthy tissue. So better visualization of the tumor boundaries and adjacent healthy tissues, which is going to promote better clinical outcomes. And it's been reported in clinical studies that they can have a localization error of less than 1 millimeter, which is pretty precise. One study compared the use of just ultrasound versus the use of ultrasound fusion and CT, and found that there was almost double precision, or double the amount of tumors located and found versus just standalone. So 70% versus 35.7. Two common systems that you'll see here are going to be the Explorer image guided system and then the Philips Epic navigation system. GE and Philips sell these 2 types of enhanced systems that allow for image fusion therapy. Thank you and have a great day. Here's some, last slide is going to be my references. Sorry. Thanks.